am at the Body Mechanics, right?
Yes, the Body Mechanics.
So Vanessa Amar is my new athletic therapist.
Yes.
And the story in a nutshell is she contacted me through my blog and offered me 3 treatments. I think maybe you should explain better.
So basically, like, I had read everything you were going through and all of that, and I saw that you had undergone the mastectomy and full reconstruction. So what happens with that is a lot of time we see post-mastectomy patients that experience a lot of neck pain, shoulder pains as a result of the scar tissue that happens after the surgery. So I was touched by your story and wanted to reach out and tell you what we do here a little bit.
Yeah, and then I remember Vanessa was like, oh, do you ever get like back pain? And then I realized, and I was like, I do. And I realized like the whole left side where I got my mastectomy and my reconstruction, I would always have like either neck pain or shoulder pain on one side, or if I'm working out, it'd always be more sore on this side. And she made me realize, I was like, oh yeah, maybe I do have that problem.
Well, because a lot of times after the surgeries, they're like, okay, you do physio for your range of motion to get back your range of motion after surgery, but they don't really think about the long-term effect of having the scar tissue that restricts your movement, and then you can develop other secondary conditions that develop chronically, where you get more tension on one side of the body, or even some people start developing shoulder tendonitis, things like that, that are results from the surgery, but a few months later because of the scar tissue that built up from the surgery.
Okay. So what exactly is ART?
So here at the clinic, so we're all athletic therapists, but we specialize in active release technique, or ART. So basically it's an advanced manual therapy technique where we put muscles under tension and lengthening and shortening positions in order to break down the scar tissue or adhesions that are in between muscles. And the goal of that is to restore the original function or the original biomechanics of the muscles by breaking down the adhesions. And this way you can go back to the original function of the muscle.
And you think it's really helpful for women who've undergone like a mastectomy and reconstruction?
Yeah, definitely. Like I said, like, it's not something that happens. We can start treating right after the surgery, the same way you would go see a physio in a hospital. You could go see an athletic therapist and do a little bit more of manual therapy as a preventative measure, but a lot of times that's not offered at the hospital. But for women that find themselves a few months after surgery developing tensions, you can get neck pain, back pain from the tension pulling from the scars that you have from the surgery, then definitely you need to go with manual therapy to go and break down the scar tissue, which isn't something that can be done with just the range of motion exercises that are given to you guys as a basic rehab tool after the surgery.
Well, it's been this is gonna be my 4th treatment, I think.
Yeah.
My 4th treatment, and every time after she does the ART on me, like right away, because I don't know, I'm sure you guys could relate, but when I lift like my armpit area, it's always super tense, and after she does the treatment, like right away I feel more like flexible, and like I can stretch even further than before you started doing the treatment on me.
And that tension that you feel when you were lifting your arm, like for you it's just, okay, I feel tension, but what you don't realize is if this is pulling, then your shoulder is always more down. If your shoulder is always more down, you can develop imbalances in your body, and then you develop your chronic pain that you can have a little bit more further down the line.
And we don't want that.
No, we don't want that.
All right, so I guess we'll show you guys what it's like.
The treatment? Yes.
Right.
Okay, so you're gonna start from here all the way to the other side. And go. All this enough. Good.
And this is where I want to fall asleep.
Hence the water here, so you don't fall asleep.
Like I feel normal after.
Yeah. Yeah, that's good.
Compared to like when I was talking there,
Yeah,
when I
you
did
did the
this, I
movement.
was just like already like when I was explaining it,
Yeah.
like I always feel like a little pull, but now like I'm just like
Good. And then as it goes along, like the more it'll be maintained,
Yeah.
like from treatment to treatment, like it should be like you don't need to come forever, you know.
That's
Like it's
it.
more like after each treatment, what remains with you should stay
Nice.
for longer periods of time.
So if someone wants to come visit you for some athletic therapy,
Yes, definitely.
what do they do?
So they can call the clinic here at the Body Mechanics. So you call the clinic and you request an appointment with me, Vanessa, and we can help you through your journey post breast cancer recovery.
Yes.
So and continue healing and maintaining all the good results.
Thank you so much.
You're welcome.
for the therapy, and I will give you all the information in my blog post below. Bye.
Bye.
I should take off my bra too, right?
Yeah, it'll be easier. You don't have to, but yeah.
Doing a little strip show for
Yeah.
the viewers.
And cue in the music.